patients, I'll put a gait belt on them. I mean, I know that Marcus, if he feels uncomfortable, I'll push the bars or whatever. Go ahead and put your arms across your chest. But normally you should have a gait belt on them if you don't know the patient. And so just standing here, I want you to close your eyes. You're going to stand for 30 seconds or whatever you can do comfortably. Ready, steady, go. And have y'all noticed that, see what he's done? He's actually tipped his head so that he's moved his lateral canal in line with where he's on the floor, right? And he does that without thinking about it, but it makes his balance better because it lines up his canal more. And you'll see that a lot in patients where they look at the floor. You know, they look down. Part of it is they want to know their environment, but part of it is because they're trying to line up the canal so they feel it better. And so if I bring his head up, back into like normal position, we'll see that his swaying. And so it's kind of interesting, right? That he did that. He knows to do that because he's compensated really well for this for many years, unfortunately.
So that's not true for anybody? Wouldn't it be easier for anybody?
We can try it both ways. When, you know, come back here and try it and see if you feel the difference. But you can see spontaneously he does that because he knows it makes his balance better now. All right.
So for the test, you want to make sure their head's
Yeah, that's standard
straight
to keep
then?
the head up.
Okay.
Yeah, that's good. And then go ahead and stand on the foam pillow. Again, put your feet as close as you can comfortably, looking straight ahead.
I'd already failed this
Arms
test.
across the chest, first with the eyes open. So you want to check 30 seconds with the eyes open. If they have real trouble with it, then you know, okay, the eyes closed is going to be hard, so you're kind of spotting them real close. The thing about spotting with vestibular patients, if I do this with him, his balance is going to be 100% better because I give him more feedback, right? Now he knows where he's getting information about where he's in space from my hands. So go ahead and close your eyes. We'll try for 30 seconds. So there you see the sway, right? And it's a little bit, I mean, most of my patients go, you know, they immediately try to grab on. So I put one finger on him. Do you see what happens to his sway? It's gone, right? And why? Because now he has all this information from his shoulder and his back about where he is in space. Take my finger off, and the sway comes back. Right? And so you can go ahead and step down from there.
For that one too, do you want his
So
head
important
straight,
thing-
or is it
Yeah,
okay that
standard,
he's bent?
Standard is yours and mine with the shoulders, yeah. But note that when you're writing things down, because that makes sense if you think about the fact that he's lining up his vestibular system, right? He can feel better when he does that. His movement is more correlated with where he is in space. Right, so go ahead and put your one foot in front of the other, heel to toe. When we did this unit in my class when I was in school, we found 3 of us that had vestibular deficits that they didn't know about. One was a gal and I had gone on a clinical at a pediatric place, and the way it turned out, she just happened to go with the one therapist and I just happened to go with the other. But she and the therapist were exposed to this really bad bug with this one young patient, and the therapist ended up in the hospital, and my friend ended up with labyrinthitis. So it's like, it was just a random thing. Like if I had gone in that room instead of this room, I would have been in the hospital too. Like, so, I mean, she ended up with a really bad, I mean, she was having double vision, it was really bad. So I was like, oh my God, really scary. Universal precautions, people, universal precautions. But the child, you know, didn't show at that point the bug. It was like, it could happen to anybody, you know. So go ahead and put the one foot on the other, arms across the chest. So this is a Sharpen Romberg. This is the standard position with arms across the chest. Easier is here, and then easier is right arms out. And you see that in a lot of the diagrams for the exercises. All right, so go ahead and close your eyes. I'm trying for 30 seconds. So you see that slide to the side in the correction. I would have stopped the clock at that because any step outside of the tandem, you would stop. Okay, and switch your feet. Go ahead and put the other foot in front. So you want to look very carefully for how they're distributing their weight, because you can kind of tell that he's here, right? He's all on his back leg. Bend your front knee a little bit. You see how that brings him back to the center? And so there's a tendency, I think for all of us, but try it on yourselves with your partner and see, you know, there's a tendency to hang, I'm exaggerating obviously, but to hang back on that back leg for whatever reason. But if you keep your center in between your feet, that's where your balance is best. Right, and so one more time, arms across, and close your eyes. And you see it's important to try with both feet because one may be easier than the other. Because just like you're right-handed, left-handed, sometimes you're right-footed, left-footed, right? In soccer players and stuff. So we see the postural sway. And again, if I do this, sway goes away. That's important for you. If you're holding the gait belt like this, you're giving him a ton of feedback, right? As soon as you let go, you're going to see the actual. Good. Okay. Try to face the sidebar. Put all your weight on one foot. Hands by your sides for this one. Just looking straight ahead. Go ahead and close your eyes. was 5. Do you have a question? Did I see it here?
So does it matter if you have your shoes on or shoes off?
That's an excellent question. I mean, just from your personal perspective, what would you think?
Shoes off would be a lot harder.
And it kind of depends on the patient,
And
but
what kind of
typically.
shoe are they wearing? Either narrow shoes, wide
Exactly,
shoes?
because your shoes tend to increase your base of support, so they tend to make it easier.
Right.
So usually, standardly, I do it with the shoes off, unless there's like some kind of issue with the foot, or they can't stand because they have to have inserts, or, if they have a brace, I want them wear the brace, things like that. But typically, if they can, if it doesn't bother them, I try to get them with their shoes off. And that's kind of standard across the tests. But you can try them both ways and see if it makes a difference for you. Okay, and then go ahead and try the other side. So eyes open first, just kind of get on that one side. And you can tell, he can stand all day on one leg with his eyes open, right? No problem. But close your eyes. And open your eyes. And so that, you call that that's when you stop the clock. As soon as you saw if there's a hop or the arms come up off the hand. And that's important in the BEST test. They have a real serious criteria for when you would stop the clock. So we do all those again on the foam pillow for the BEST test. So go ahead and stand tandem on the foam pillow.
How much time is normal for that? For the one
You're
that-
trying for 20 to 30 seconds. I think the BEST test has it normed at 20. And then I usually use 30 seconds as my
That seems like a long time to be eyes closed. all
So
the
try
time.
both. Yeah, try both. But typically, it shouldn't matter whether you're standing on a pillow or not. You should be able to do 30, 20 seconds if you don't have a vestibular problem. Well, and you bring up an important point. I mean, there's a whole range of normal out there, right?
Right.
So we're just looking at norm as opposed to what the research says. But the average person over the age of 65 without a vestibular deficit can only stand on one leg for 3 seconds. That's normal.
Okay.
But people in their 20s and 30s who don't have pathology, 20s, 20, 30, 40, because I'm in the 40s. 40, that's young. All right, so one foot in front of the other, arms across. And then close your eyes. So he's very strong in his legs. You can see that he's compensating with his strength, right? He's kind of tightens down. We're going to talk about ankle strategy, right, versus hip strategy. I know some of you have already kind of explored some of this versus like a stepping or grabbing. If I grab or step, what do I do to my base? Widen it, right? I enlarge my base right away, right? Or in athletes, a lot of times you'll see the suspensory strategy, like get low, right? Your coach is get low. That's how I kept my son from falling over backwards when he was learning how to roller skate. Just get low. Because he would go right back. Try it on one leg. Just push this with your eyes open, kind of get into the position. And then arms across. For the BEST test, it's all normed this way, all the tests. I usually start with the hands down because I know this is hard for pretty much everybody, like you said. So close your eyes. And so typically, not always, but typically people tend to lose their balance to the side that's weaker. Not always, because sometimes they feel it and then they overreact the other way. So thank you, Marissa. That's very helpful for us to see some of that.